All right. Hello, everyone. Let me, give me just a second. Okay. Awesome. Well, greetings on this beautiful November Wednesday to everybody. This is the monthly open forum at Coeur d'Alene Healing Arts. And I am here with, oops, watch my tea. I'm here with a colleague and wonderful provider in our community, Carrie Kralicek, who works as a psychiatric nurse practitioner in private practice and has been connected to the Coeur d'Alene Healing Arts community for many years. We're grateful to have you here to share and talking with me today.
Thanks.
Yeah, thanks for being here. And thanks for everybody who's tuned in to be here live. And then, of course, those of you listening to the recording when we post this to our website sometime in the next week. For the live audience, if you do have questions or health topics that you want to cycle through to ask us, please do put them in the chat, and then we will circle back to them probably at the end of our meeting, so that we can just kind of stay in the flow of our conversation. The topic that we're going to present to you today has to do with something near and dear to my heart, mind-body medicine. And of course, introducing Carrie, knowing that psychiatric care is literally her entire clinical practice, it felt great to bring someone fully immersed in that field into the conversation with me. So we can talk about this in our community, in our society. And I'm trying to think of a really good way to start off our conversation, because it is, the concept of mental health is very much central to our topic today. So, I think really like kind of an interesting question to ask you, Carrie, is how do you see, like, in our community, your particular exposure to people having challenges with their mental health and what that kind of looks like in getting to talk to people about how it's affecting their life and kind of what's going on in terms of why they're seeking your help. I'd love to just learn about that for you.
All right. So from my perspective in my practice, I guess I'll put it out there. I see a lot of first responders.
Yeah.
I see children.
Yeah.
And I see people that aren't first responders too.
Mm-hmm.
I'm fortunate to be in a private practice so that I can do what is best for each patient because it's not cookie cutter.
Mm-hmm.
And a lot of the mental health problems that I'm seeing oftentimes stem from physical health problems.
Okay. Nice.
And also trauma. That would be the other one.
Mm-hmm.
Because that affects both mental and physical.
Yeah. And when you say, mental health challenges, like, give some examples of how you're observing someone's like mental emotional capacity being limited to really affect their life harmfully. Like, what are some examples of, what that tends to look like in your population?
Are you asking like for with post-traumatic stress?
Yeah, just really like it could be that, like just generally how you feel that, people's mental health is limiting their quality of life, their freedoms in life, like kind of just get a flavor for what people are dealing with out there. Cause I think that's a really good introduction to like how to approach dealing with it is what are people dealing with that you've seen in our community, in our evolving society that, and it could be the populations you see is going to reflect that.
Right. Well, I believe that the mental health issues that I see, the limitations on the patients that I have is their own perceived acceptance into society or community.
Okay.
And
Yeah.
how they interact with other people. Isolation is a big one.
Okay.
Getting stuck in their minds.
Being stuck in their minds.
Mm-hmm. So because a lot of people think from my perspective, when I'm speaking with somebody, because I do a lot of psychotherapy
Mhm.
and I do EMDR, which is eye movement reprocessing,
Yeah.
desensitization reprocessing. And I do trauma-focused cognitive behavioral therapy techniques most of the time. So it's trying to assist somebody in moving forward and being able to recognize that what they're feeling on the inside is not always what other people are seeing on the outside.
Mhm. Mhm.
Because a lot of people feel that embarrassed or ashamed that there's something wrong with them and that they're not a complete person.
Okay, yeah. So this concept of um, inadequacy, esteem, and just kind of how that proliferates into people's lives
Mhm.
in an adverse way that, like, limits, their happiness, their well-being.
Right,
Uh-huh.
right. And so
Yeah.
when I have a patient that comes in, they tell me what's going on with them, and then we navigate together on a plan.
Mhm.
And that's where it's so different because some people are already doing, exercise, or maybe they're doing food as medicine.
Mhm.
Maybe some things are good, but other people, for the majority, I would say that's not the case. There's a lot of work to be done.
Mhm. Yeah.
And that's when I continue to do the therapy, but I would refer to somebody else that can go ahead and provide their knowledge,
Yeah.
such as you. I mean, that's why I go see you.
Mhm. Okay.
That's patient confidentiality. I breached my own.
Yeah.
But
Yeah.
so that's how I navigate. I could figure out what's going on.
Yeah.
A lot of people have poor gut health. I was one of those people.
Mhm.
And trying to figure out ways to decrease the stress response in the body so that they can start healing.
Yeah. Right. Yeah, and you're kind of bringing up a really important point, I think, to this lecture that I kind of want to jump in on, which is my observation is that our culture as a whole has a very big um, kind of demarcation and line drawn in the sand between mental health and
Mhm.
physical health. And literally, we have structured our system for help to say, if you're struggling with issues of the mind, go to a practitioner, provider, that is their, their expertise, and we're going to work on fixing your mind or making your mind more stable so you can function better. And then if you have expressions of disturbance, limitation in your physical body, then you're going to go to a physician or a nurse practitioner or a provider that focuses on the physical health of the body, and we're going to stabilize, um, improve your physical health so that you don't no longer have a physical health limitation. And I think what I just heard you say in starting to get into like how you begin to approach as kind of in that pot of mental health provider
Mhm.
is that actually you're already acknowledging that, well, there's two are so interrelated
Mhm.
that how can we, only go work on one thing for mental health and then one thing for physical health on the other,
Mhm.
and that your practice allows you to like recognize that interconnectedness.
Well, I'm not going
Yeah.
to fire myself,
Yeah.
you know?
Mhm.
um, and sometimes when you're working in or for an organization, you don't have the freedom to do the right thing.
Yeah.
And I hate to put it that way, but
Yeah.
that's probably a lot of the reason why I was called into somebody's office.
Mhm. Mhm.
And I'd have to give my rationale, and they say, well, okay, but probably this, that, or the other. All
Yeah.
right. So,
Yeah, so we kind of then get to sit in this room together, and as we're talking to our community, and really acknowledge that, I guess I'm feeling a tremendous amount of gratitude here for the opportunity to work with my community, in that myself, I have a deep passion for how the mind, our mental, emotional body, how it works, like how it influences us, how it guides us through our day or runs us through our day continuously. But like what what informs its function? Like what makes it calm and peaceful and well, and what destabilizes it? And going back to that statement about the schism between physical body care and mind care or brain care, this idea that in our society we don't have a fluidity to like be able to interact, to work with the interactiveness of those profoundly connected forces. I feel very blessed and grateful that in my medical practice I actually can completely embrace both in a fluid and continuous way through my work with people, and it sounds like you get to too.
I do.
Yeah,
I do.
yeah.
I mean, I may know what something is and where it's stemming from, whether it's an illness that is of the body, a medical problem. I can rule that out, and I do,
Mhm.
but I'm not the one that's going to treat that.
Right.
So I have to pass that person on to whoever has the expertise in it. I mean, some things are emergencies.
Right.
When people come to me, it's interesting because, I mean, I've had people come to me that think that they have ADHD. Well, no, it's absolutely not ADHD, but you have to rule that out. And it's severe anxiety related to a medical problem that requires the emergency room. So
Mhm.
emergency rooms are great for emergencies and to
Right.
fix things, but
Sure, sure.
fortunately, that's not all of the time. But
Yeah.
to be able to do that and says, oh, you've got ADHD or have a pill,
Mhm.
it's
Yeah.
not.
Yeah, I mean, I feel like the interesting thing that you're on the psychology side, I'm on the more medical body side, is my exposure to the mind body connection ends up being really like initially emphasized on the physical. So I'll give an example. Someone comes in with a physical expression of stomach pain and heartburn. And, we get into having this conversation about their physical symptoms of stomach pain and heartburn. And as I learn broadly about what's going on in their physical body, I can say, okay, here's what's going on nutritionally. Here's what's
Mhm.
going on with, you know, different like functions of your digestion. Here's what's going on with your sleep. Here's what's going on with your supplements and your meds and your lifestyle habits and your drug use and all of the things that physically interact with that stomach pain and heartburn. But my process doesn't stop there, where I think most of conventional medicines does. It says, hey, let's talk about stress,
Mhm.
let's talk about your life circumstances. Oh, let's talk about how you grew up. Like, let's talk about what keeps your mind disturbed, when it does, how it does. And oftentimes that's where a beautiful thing happens. Again, in this, I'm taking it from the physical medicine based provider, because often people will light up these sparky connections where they say, oh, interesting, like this problem began when I went through a really stressful time in my life. And now, oh, when I really pay attention to it, Monday mornings, my stomach pain is a lot worse. Well, what happens on Monday morning? Oh, I go to work. Okay, well, tell me about work. And we can just unfold this like really interesting story about what is going on in their mind in terms of how they're relating to their life and the world around them, that actually seems like there's quite a bit of
Mhm.
connectedness to the times these disturbing physical symptoms express themselves. And so I think why I want to tell that little anecdote is I
Mhm.
want to like, this whole theme of this talk is about the mind body connection. And so what the argument is that the mind influences the physical body and the physical body influences the mind. And so as a physical body doctor, interestingly, I get this exciting opportunity to illuminate with patients sometimes when it seems clear as the conversation unfolds that these physical symptoms you're having are at the very least connected to and are contributed to by the way your mind is interacting with your life and the way that it's causing your physical body to respond. Um, and that, of course, the illumination of that is profoundly important and powerful,
Mhm.
because even just understanding that and having that illuminated in a meeting is to be like, wow, now that I see this, I might be able to really change. I can make a decision in my life, or I could see that differently and not hold on to it as, in a way that is so straining to my mind and body. And so people, by understanding it's going on in the connection, already can have healing. But
Mhm.
furthermore, by getting that out in the open, these tendencies and patterns, and then going even deeper into where does this come from? And, you know, we can actually like set a path toward complex change that really
Absolutely.
like resolves how the mind is straining and then consequently the body.
It's a
And
beautiful process. It
yeah,
really, it's such
yeah,
it's a trait to be able to have that insight and see it. And when you make that connection, or when um, the person you're sitting with makes the connection, that it's rewarding for everyone.
yeah, it is.
Maybe
It's
not
yeah,
always for the person that's sitting there at
yeah.
first, because
Not
they have to
maybe in the
process
moment.
it.
It's a processing, yeah. But I kind of, as I share that, I want to like, kind of reciprocate back to you to say, because people are coming into you with, I am dealing with in my mind, anxiety and, you know, kind of like a sense of doom, or, a helplessness, or
Mhm.
a, complete lack of motivation. Some of these like, I'm not able to go out in a store because I'm so anxious, like these, we
Mhm.
consider them mental health complaints. I'm really curious, like, how that goes for you to start to illuminate to them, you know, as we pay attention to your physical body, how we can start to connect up, how this section might be contributing to these mind disturbances.
Well, you're talking about a store is what in my mind, I'm thinking somebody having a panic attack.
Yeah, sure. Panic attack, right? That's a good example.
A
Yeah.
panic attack, which feels like you're dying in the moment.
Yeah.
And
Yeah.
a lot of the people I work with have, and I call it post-traumatic stress. Um, I know people put a D on the end of that for a disorder, but I don't think of it as a disorder.
Yeah.
It's an injury.
Hmm.
So a lot of the people I work with have the PTSI, and it's about, first of all, you have to establish that rapport, the
Yeah.
trust, because you're
Mhm.
talking about things that
Yeah.
a lot of people have never shared with anyone.
Yep.
And I'm sure you run
Yeah.
into that too.
Oh, yeah. Mhm.
Um, and when I have a patient that comes in, I have probably about, especially with first responders, about 30 seconds
Mhm.
to see if they run out the door, and
Mhm.
it hasn't happened yet.
Yeah.
There we go. But
Yeah.
in the time, what I do is I just ask them what they do, and I just ask them about themselves. And so they start telling their own story. So I
Yeah.
really don't have to ask a lot of questions.
Sure.
Um, I think I got off the road here.
Well, I mean, what I was
Apologize.
getting at is like, does your process and how the flexibility you have and how you approach things allow you to see how someone's taking care of their body
Yes,
physically
absolutely.
affect their mental health and like
Absolutely.
play a
I get
role
you.
to destabilize their mental health? Because
Right.
that's the other direction we're trying to kind of illuminate.
Absolutely.
Yeah.
So when I have a patient that comes into me to see me, they fill out their paperwork, but they never put everything on there. And
Yeah.
we do an hour and a half to
Yeah.
2 hour visit for a first session. And then
Yeah.
usually it's an hour afterward, because I don't push people in and out, because 20 minutes is not enough time.
Yeah.
So
Yeah.
what we do is we talk about, medical health, injuries and things like that. And
Yeah.
then I can go ahead and figure out what's going on with them physically to make sure that I'm not missing something there. And then mental health wise, um, I start tying it together with, if they're taking medications, I find out what those are. It's
Yeah.
interesting, a lot of patients are willing to take medication, but not as willing to take medication for mental health, like
Yeah.
antidepressants and whatnot.
Right. Right.
So, which is fine by me, because
Right.
I think that therapy can work through a lot of it, not everything. But I'm able to converse with the person by mostly them talking,
Yeah.
and they start figuring out what's really bothering them. If
Mhm.
it's the anxiety, a lot of times it's anxiety. Am I going to make it home after my shift? And what's going to happen to Johnny and Susie? I just made those up. I don't have any Johnny or Susies. So Johnny and Susie, if I don't make it home, they're
Mhm.
not going to be successful.
Mhm.
So well, I ask them why. Why are you
Yeah.
worried about that? And a lot of
Yeah.
times they don't know. And I'll say, well, what's going to happen? What can you change? And they'll go down the road of, well, finally they figure out, well, I'm frightened. I'm terrified that I'm not going to make it home, and my anxiety gets worse. And there's a reason behind their anxiety.
Sure.
So I try to get in there and teach them how to not be anxious about that. Instead, teach Johnny and Susie how they can be successful in the event that you don't come home.
Mhm.
And that way, they're not going to be poor. They're not going to be
Sure.
without.
Yeah.
Things like that. Does that make
Yeah,
sense?
kind of, yeah. Mhm. Yeah, working with the psyche and
Right. It's kind
yeah.
of like
Mhm.
it's kind of like the guy that is afraid of flying. Have I ever told you this one?
Nope.
Okay, afraid of flying. He has panic disorder and he wants Ativan to fly. Okay, well, what's the real reason why you're afraid? Well, he has a diagnosis coming to me as generalized anxiety disorder, which people say that's hard to treat. Well, no, it just takes time. So the guy on the plane gets on this airplane and he's telling me, well, I'm afraid of flying because I'm afraid. Well, what are you afraid of? And finally he starts yelling, well, I'm afraid that my kids are going to die, you know, because if I die in the air, there's going to be nobody to take care of them. I'm not going to be able to go to their weddings. They're going to be poor. They're going to be homeless, and they're going to be on drugs.
Mhm.
So it's that negative loop.
Mhm. Yeah,
And
worst case
trying,
scenario thinking.
right? So
Mhm.
it just takes a lot of work. I hope I
Mhm.
answered that.
Yeah. Yeah, I mean, I want to bring like another facet to me into this, like the connecting points to, like, I'm going to use the term brain now, so I'm going to like really talk about an anatomical concept to the mind. Maybe I should define the mind, and I'll do that in a second. But the idea that, you know, what's physiologically going on when we have feelings of anxiety, when we have feelings of depression, of sadness, of grief, of worry, of fear, like what is the physical expression in our body happening? Well, we can break that down to ultimately neurochemicals, neurotransmitters are being secreted and expressed as our mind or our brain is flashing through these thoughts, and the connection between our frontal cortex with our limbic system, with our hippocampal memory system. I mean, they're all swirling into many layered, complex processes. But at a fundamental level, it's this like communication between all these other parts of our brain that then are communicating into our body. And then we like literally notice when we're really anxious, say getting on that plane, we have, a heart racing, we're sweating, our blood pressure goes up, our
Your throat tightens.
yeah, you have your throat tighten, you have essentially like you can't think well, um, all these different phenomenon come up. And so really like that's some physical expressions again of this mental process that's really at the like chemical level, what's happening, and all of our nerves coming out of our brain are talking to all of our tissues and organs. So that's again that's like the mind going into the body direction of expression of health.
That's
but
it.
but if you want to turn the coin over, what happens when you know you're given like a stressful situation, say of like having to have perform really highly at work for like prolonged hours, to your mental health, if your brain isn't working and firing well, if like the pathways aren't really engaging appropriately and efficiently. And I think that that's where attending to the body's needs really has this huge play into mental health. Because I think the better example, let's just say a behavioral diagnosis of ADHD in a child.
Mhm.
And so when I see those children and their parents are coming and they're saying, my child is, having these temper tantrums and they're out of control and they're just like, can't relate to the world and they can't be reasoned with. Like I can't access their mind. I can't I can't calm them down, and they can't stay focused in school. And so there's like they're getting behind in their coursework because they can't focus. They can't be, they can't, mentally execute. And so as I talk to people, a lot of times, one of the things that's really easy to elicit is like, let's talk about what they're eating. And I learned that, well, it turns out they're having a really processed food diet and they're having a lot of sugar. And sometimes, even that initial conversation, the parent might pick up, oh, you know what? I've noticed when they have a lot less sugar in a day, they don't have as many meltdowns behaviorally. They don't get as anxious and inconsolable and emotionally totally dysregulated. So that might even just come up in the initial meeting. But other times we may say, hey, I'm pretty certain that if you change the nutritional environment of their physical body, that their brain's going to work better. And that if you, and I'll get into the mechanisms of this, but if you really like, and not only the nutritional environment of the literal foods they're taking in, but how their intestinal system is kind of where they manufacture a lot of their neurotransmitters. That's where a lot of inflammation kind of process is generated from. And when a brain is inflamed, it generally doesn't operate efficiently, and it gets kind of like very like prone to error and dysregulation. And so, you know, often I'll state all of this and I'll say, hey, let's clean this up and let's use food as medicine, and let's get off processed sugar. Let's get on whole foods. Let's get on healthy proteins, healthy fats. And I even have specific dietary protocols that are based on the gut brain connection. And what almost every time, and I treat a lot of pediatrics, so I can see this, is that almost every time, if the parents are willing to be compliant, big asterisk, because kids, none of us want to change our habits generally very easily. But if people do change them, then, tantrums precipitously drop, behavioral issues at home, in school dramatically improve, and, thriving in school, et cetera, and kind of like their ability to concentrate and focus dramatically increases. And so this is a very nice, succinct example of when, again, in our society, we would normally take this kid with ADHD and behavioral issues and send them to a, mental health provider, and they would focus on exclusively mental health interventions, maybe even, behavioral counseling, talk therapy. It might be drugs though. And instead here we basically done some very concretely physical things in their physical body, and their mental health has dramatically improved.
And I've seen that too. I have seen that with food, and changing also sleep patterns, because that's important too.
Sleep. I was thinking about bringing up sleep, so go ahead. Yeah, say
sleep
more.
is so important, and it ties in with the food too, because there's certain processed foods that keep you from restful night's sleep.
Yeah, that's true. And an interesting thing, like you can think, to add on to your comment about sleep, one way to think about sleeping is one of the most incredibly valuable thing happening in sleep for the brain, i.e. the mind, is that literally you are going through a deep clean scrubbing process of your brain. And there's all sorts of this term, the glymphatic system, but essentially like the lymph system of your glial cells or your brain, that you need that at minimum 6, ideally up to 8 hours of sleep, good restful sleep at night, for that glymphatic system to scrub all of the brain tissues clean, remove the debris of the day, so that you can, face another day. And so, yeah, if sleep isn't happening, that's a huge way to destabilize, the mind's function, because you're not getting that scrubbing and restoration. Also, we know very clearly from neuroscience that a lot of the processing work of your emotional, executive, mental experiences of your day really gets integrated in your sleep, in different deep sleep and
Absolutely.
REM sleep parts of your sleep cycle.
And I agree. And it's amazing with sleep that the process of being in REM with your eyes moving, that is where that EMDR during the daytime
Mhm.
also helps.
Yeah.
But
And maybe define the REM to people just so they understand a little bit more about it.
so the way I explain it
Yeah.
to my patients, because you have to explain it that way,
Mhm.
you never know who you're speaking to,
Sure.
is that when you're sleeping and you're in REM, a good REM sleep, your eyes cross, you're just going back and forth
Yeah.
like that. So
Yeah.
that is where you start reprocessing your daytime events.
Okay.
And
Yeah.
that's the simple way to put it.
Yeah. And if we don't reprocess them, would the actors say they kind of just stack up and kind of overfill?
Irritability,
Yeah. Mhm.
anger,
Yeah.
appetite changes, you
Mhm.
name it. You know
Yeah.
that.
For sure. No, I know. I was just saying to the
That
group.
appetite changes,
Yeah.
mood, it can
Yeah.
it affects everything.
Yeah.
So
Yeah.
stress response,
Yeah. Yeah. Appropriate stress response.
right?
Yeah. And I think it's like nice in our with our group of listeners here, like to really walk out the foundational physical inputs that are so critical to how our mind operates. And I think I'm going to bring up the next one, which is physical movement. You
Yes.
know, this idea that when we move our body, and it's not just like when we're cleaning our house, I mean, or like we have a physical job. I mean, it is physical movement and that does have a value, but I think, you know, particularly if it can be in nature and it can be with the specific intent of like, you know, like not focusing on anything else but our movement process. So it could be going to a gym, it could be, you know, going for a run, or it could be, you know, taking a walk in nature. I mean, it doesn't have to be defined and go swimming. Like, um, there's not a right answer to this, and everyone's a little different. It could be high intensity, it could be low intensity or restorative. But we've done like all sorts of research on this, of course. And interesting, we were talking about EMDR and your eyes crossing. One of the other cool research pieces is we've learned that the cross crawl of walking, when your arms
Yes.
swing like this, it's
It's
actually
tapping.
it's
It's
yeah,
tapping.
it's a methodology to
Yeah.
process, you know, our emotional and psychological, you know, experience of our day or life,
Mhm.
or past life. And you know, so that's a literal example that they've, you know, done some really nice research on. But I think another thing to I have two other things to say about physical activity. The first is that when we move our bodies physically, we move our circulation, and
Mhm.
we cannot underestimate in all facets of health, including mental health, the importance of healthy circulation to healthy function of tissues. So, like, you know, I mentioned the lymphatic system, which is the lymph circulatory system of the brain that is particularly active at night. But we have a massive circulatory process going on in the brain, that involves, you know, our blood, our lymph, our cranial cerebral spinal fluids, and pumping that through our brain is partially a condition of movement. If we're sedentary and stagnant, our lymph, our blood, and our cerebral spinal fluid will be much more stagnant. So I think that, you know, we can like look at that as one of the very physical inputs to mental health.
Mhm.
And another last way I think about movement being so critical is many of our mental health distortions are and disturbances and instabilities are, you've referred to it several times in our talk, you so much is going on in your head, like your whole existence is being kind of like, um I'll say like hijacked by your mind, by what's going on in your head. And so when you have rituals that ground you into your physical body, like exercise of any form, movement practices, you're literally helping yourself get out of your head. And you know, we talked about this prepping
Meditation.
for this meeting, like breathing,
Mhm.
like consciously breathing, belly breathing. That's a form of exercise. It's exercising your diaphragm, but it's like it's the same concept to me that when mental health is unstable, it's because your mind is kind of capturing your whole existence and it's kind of like swallowing everything else. And when you can be more in your physical body, that imbalance gets kind of helped a little bit.
Right.
Yeah. So I wanted to kind of name my next big physical engagement to honestly balance mental health in my experience.
Hmm.
Yeah. Mhm.
Yeah, no, movement is very important, and that it's so individual for everybody. It's
Yeah.
I guess kind of like what people's belief systems are too. So everybody's different. So that's another piece of what I do is I figure out what does that person like?
Yeah. To
Do they
do.
like playing basketball?
Yeah.
Do they like swimming, like you're saying, walking in nature? I try to get my patients to agree to some sort of exercise and staying with it. A lot of the people that I have found that even a lot of my patients are men, but even they are like, okay, well, you know what? Maybe I'll go try yoga.
Yeah. For
And
sure.
I say, it's for everybody, you can do whatever you want to do,
Yeah.
but it does help them and it allows them to get out of their brains. And that's
Yeah.
what I would like for
Yeah.
my patients to not always be stuck in their head.
Yeah. Have more practices for
Mhm.
that. Yeah. Yeah. Um, and so it's interesting too to tie together maybe like we should have started the lecture this way to kind of have like a little bit more, you know, public health crisis alert in terms of
Mm.
mental health. Recently, I don't know if anybody caught this, that parenting was, cited by the attorney general as, a severe risk to health on the level of like smoking, for example, because of the stress of parenting in our particular culture and how it's evolved. But I think it's just to name, and we're all well aware of the quote unquote mental health crisis in our society. So this idea of talking about this is so relevant to me because I see most of the people I come in to work with me, the mind-driven stress really being a big driver of what's adversely affecting their well-being. I'm not even going to say physical health, just well-being. Um, and that's a very modern phenomenon, right? Like you used to see, in the medical literature 100 plus years ago, sporadic evidence of, they didn't even call it anxiety, they called it like neurasthenia
I
or
was gonna say neuroticism.
neurotic syndrome, or like um or kind of like, you know psychosis. I mean, I'm forgetting some of the old terms, but it just wasn't common in many of these chronic, mental health processes that are so, especially in our young adults or teens, and certainly adults are just prolific. And we have to start to question, what are all the reasons for this changing?
Mhm.
And I think some of what we've talked about on the physical side is a really big, emphasis. Like we don't move very much in our modern sedentary society. We don't eat very well in this modern
Which messes
society.
with hormones too.
Yeah, absolutely.
And that's another huge factor. Go
Yeah,
on for that one for a couple hours too.
yeah, yeah. And so, yeah, naming some of these physical things, but then, on the flip side of the coin, I really wonder about, it's like, what else, is driving stress and mental health affecting our well-being so dramatically overall? And another big thing, it's interesting, we're having a meeting the day after an election, like a big national
I
election.
thought that too.
Like, remember our ancestors, um, they weren't so connected. It's a weird paradox because our ancestors were not globally connected to all the awful, horrible, sad, tragic, hard things going on in the world. Um, and fear, negativity, like worry, concern for the state of affairs of, way beyond our like insular day-to-day life. um and at the same time, right now, we suffer, while we're so connected to information and all the emotions that information brings up, we suffer from an immensely higher degree of isolation. You already spoke about feeling isolated as a big harm to mental health. Like people don't have as much connection. Like we grew up in tribal, community settings where we were, probably continuously connected to other people and sharing and supporting each other. really actively. So it's this weird paradox of isolation, yet super connectedness to this world and other people around us in this kind of like disassociative way through technology. And I find that really interesting.
It is fascinating.
Yeah, to
I
see
mean,
how that's affecting mental health.
well, and it does. I mean, I think we saw that through, pandemic too,
Yeah,
because that was isolation
yeah,
and people lost their sense of community.
yeah,
And community, what your community thinks about you, whether it's good or bad, it, I don't know what the words, dictates how you're going to perceive yourself being
yeah.
involved in that community.
Yeah, like, and that was kind of going off of what you said earlier, is that a lot of people's sense of self and worth and being, is to connect, shaped and connected by the environment around them,
Mhm.
their early life environment, but their present life environment. And so, yeah, I think we're hitting on something that is kind of like, it's not necessarily a physical force that is so influential over mental health, but it is a social force
It
that
is.
is powerful over our mental health, our sense of well-being, and our stability mentally, emotionally, is this idea of feeling connected to other humans, feeling loved and supported and cared for. And that is an interesting dynamic to, in a health session, whether it's, someone coming in with physical complaints or someone coming in with mental health complaints, that we definitely need to get a perception of is, what is your support structure? What is the framework of your interconnectedness to a community and the people around you?
Right.
And do you experience, love and care from others? I mean, when that's not there, the mental health fallout and therefore physical health, because all these, physical health symptoms are, influenced by mental health.
Makes me think of adaptation models.
Yeah, say more,
Really.
Yeah,
Right. And then also it,
yeah,
I know Maslow, he's overused, but I mean, if
sure.
your basic needs aren't met, it's really difficult to attain the highest.
Yeah, you're defining a
Mhm.
basic need here as an,
Safety,
yeah, yeah,
I can't even think of them all right now. Sleep,
yeah, yeah.
basic needs.
But that idea of safety, one could argue in this theme, is
Mhm.
like safety is generated by feeling like not alone in facing the
That's
the
what I'm
the, the
saying.
cares and worries of the world, that you have other people there to look out for you, to make
Mhm.
sure you're okay, to support you, should the fearful things you don't have control over come up in
Right.
your life.
Mhm.
Yeah, yeah, and I think that, making mention of this is my goal in this meeting of what I want to kind of share with our group is like, we unfortunately, and you haven't shared this, Carrie, but I know explicitly you've really de-emphasized this part of your, psychological practice unless it's really necessary. It's like, what we haven't said yet is the mental health um, crisis that we're faced with in our society is essentially being addressed, quote unquote, through the prescription of very, very powerful um, phys- you know, neuroactive and biologically active drugs
Mhm.
that essentially radically change the function of our brain
Mhm.
to, and I'm going to say this in quotes, create more stability for us mentally.
Mhm.
Um, and unfortunately, what I have seen, and these are even the people who come to me just for mental health,
Right.
needs, is that they they basically have been told, based on the mental and emotional pain they're experiencing, is that there's this very powerful pill that we're going to quickly and casually dispense to you, that is affecting immense parts of your physiology and mind, many of them not in a way that you would like them to, but it will have this effect of stabilizing your mind to not be so wrapped in the experience of deep anxiety or depression, or, you know, um, the instability that those mental emotional states create.
Right.
And what I'm seeing is people saying, I don't like how these feel in my body.
Mhm.
These affect me in all these ways I don't like. And maybe I'm not dealing with that one thing that was really, really debilitating. But now I'm dealing with all these other debilitating things. And the biggest term I hear from people is, I don't feel myself.
Right,
Like,
numb, numb.
I'm numb. I don't, yeah, I feel disconnected from myself. And when we talk about well-being, to me, a huge definition of that is I feel authentically myself.
Right.
And so like one way I speak about these very powerful drugs is they kind of they may remove some of the pain you're experiencing, but they also disconnect you
It's
from
masking.
yeah, experiencing all dimensions of your, you know, your emotions and your kind of like your way of knowing yourself. And they also affect your appetite, and they affect your weight, and they affect your sleep, and they affect your libido, and they affect your cardiovascular system.
And your body's no longer working synergistically, so yeah.
Yeah, and so I wanted to kind of bring this home to this because we've spent most of the lecture really talking about, hey, let's talk about all of these
Mhm.
forces that influence the function of your mind and your mental health, and like how we are taking the time in our meetings to explore these, to
Mhm.
really understand how how balanced or how nourished these different fundamental forces of health are, or how strained or out of balance they are, and really like engage with people on those levels with the knowledge that if people willing to have that illumination also move into habit and actionable changes, then their mental health is really going to stabilize. And again, I use that example of the ADHD behavioral child who's eating a bunch of processed food as a really succinct example.
Mhm.
But then we went on without anecdotes or examples to acknowledge many other facets of health.
Right,
Yeah.
right. Definitely, if you're moving on the medication piece, is that where you're at right now?
Yeah,
Okay,
and I
I think
think
that's
like at the
important.
same time, I don't want to unilaterally say prescription medication is evil. So I'm just sharing on
No,
my side because I don't really prescribe that class of medications, but also my patient population, doesn't necessarily, isn't even a lot of times interested
it's
in talking about it.
rare
Yeah,
anymore that I prescribe medication.
yeah, yeah,
I will continue medication if the person says, no, this is the only thing that keeps me from wanting to kill myself or somebody else.
yeah.
I mean, in that case, they're aware of that, but I would in turn send that patient to you to
Mhm.
work on other things that that's not my area of
Yeah,
expertise.
and
I can do
engage.
diet, I
Mhm.
can do all of that, and I do,
Yeah, and
but on
engage
a
all of
different
the
level.
mental health
Right,
ways to help people process their that
right. Or,
experience.
give people different teas to drink. No, I'm joking. But no, so I think that with medication, I know from personal experience going in, for myself or to a doctor's visit. It wasn't depression because of a mental health issue. It was an underlying medical issue.
Mhm.
And the first go-to is, oh, maybe we ought to put you on some Wellbutrin, or maybe you need some Versteek or whatever,
Yeah,
Zoloft, sertraline, whatever you want to
yeah,
call it.
yeah,
And no, I don't feel like I need that.
yeah,
So if I feel that way, it's very difficult for me to
yeah,
push medications, and that's not what I do. I was
yeah,
taught by a couple of amazing old school psychiatrists that every patient deserves your time to have a conversation
yeah,
and not medication.
yeah,
You're doing better by your patients by doing therapy. I'm like,
yeah,
ugh.
yeah.
And I'm an imposter syndrome is what it was. So I was like, oh no, but
Yeah,
that doctor that said that was absolutely correct.
yeah,
And I would say out of over 100 patients that I have right now, very few of them are on medication.
cool.
Very few.
Yeah,
And I do send people to other places when it's something out of my wheelhouse,
yeah, yeah, and that collaborative
because
piece
I
is so
don't do what
important,
you do.
right?
I mean, if I
Yeah,
need some help, I go to you.
yeah, for sure. No, it's
So
the collaborative piece is so big, and
it
you
is.
said a couple of like really, key things, and I want to like uh, accentuate them. One is that you said listen to people, and this kind of ties back into the like our humanness, I would say. is there is something that I have learned both experientially by receiving it from others, but also by holding a space for others,
Mhm.
that when you hold a space for a person to unfold and release and acknowledge some of the pain stored either, emotionally somewhere in their body or in their mind, or probably, where it's stored is as important as the fact that it's held in,
Mhm.
and they're able to like experience someone's compassionate listening of like, I care about
Right.
what you've been through or what you're going through, and you matter, and like, you know like this very like accepting space to acknowledge someone's humanity and the hardness and struggle of their humanity, that the most kind of immediate healing I've seen, and often a lot of tears are associated when emotion really moves, the most immediate healing I've experienced in how I practice is that kind of like healing, which paradoxically, you're not giving someone anything to ingest
Mhm.
or make it better by existing and holding a space for sharing someone's human existence. They feel better. And
And
I
the
think
energy
that,
of it's amazing too.
yeah, it's a really special experience, but I think that that's something really, part of the epidemic crisis of mental health we're talking about,
Mhm.
is that we don't really like know how to create that space or feel safe to have that space with others, or that doesn't exist in any of our practices to really like, you know, acknowledge some of the things we're feeling, or even know that we need to acknowledge them. And I think when you said, some of my mentors have taught me some of the most powerful way you can help a person is
Mhm.
sitting with them in a trusting space to like feel heard and understood. And that was what my mentor taught me too, who
Really?
was a mind body focused practitioner.
He was wonderful.
Yeah, with the like, very similar early practitioner imposter syndrome. And so I guess tuning into like our community here who's listening to this, it's like um part of the like paradox of, mental health is that when you're struggling with, worry, fear, sadness, like anger, irritability, these are some examples of emotions, um, stuck thinking, worst case scenario. One of the things that's going on is it's all stuck in yourself in an
Mhm.
isolated way. And there's this huge body of research and evidence that when we share and we get it out of our head or out of our body or wherever it's staying, that
That's right.
immediately it loses some of its destructive power in us. And so, you don't have to be a psychiatrist or a physician
Mhm.
or a counselor to hold a space of compassionate listening. But also, tragically, what we're acknowledging, both Carrie and I have like 90+ minute times with our patients when we first meet them. It's because this kind of stuff can't happen in a 20-minute visit. We,
I
we,
mean, my
we,
patients are worth my time,
yeah,
and it's
yeah,
like, okay, if I'm going to see someone,
yeah,
I'm I'm present, but I'm not, if that makes sense. It's
yeah,
their story. And they take me on a trip. And
yeah,
it's,
yeah.
when
Well, and they're
somebody,
being present with their story.
and
Yeah,
usually when I first meet somebody,
yeah.
they're like this
Mhm.
because they're projecting their heart.
Yeah,
And
closed.
right, it's because they're trying to hold that in. But
Yeah,
when that comes out, all of the emotion and their feelings, all of a sudden they go lighter and they're just kind of like sitting.
yeah,
It's
yeah,
really
it's a
cool to
shift.
watch.
Yeah. And I think that that like kind of is a term that I said, I'm going to clarify this term mind later in the talk,
Mhm.
because we've been in the last 5 minutes talking a lot about emotion and
Mhm.
how emotion is very centralized to mental health,
Mhm.
is the term mental health, we use it. But I think that the funny thing about emotion is, yes, emotion is regulated partially in our mind, but it is experienced
Mhm.
throughout our body. And we often use this term heart, which literally sometimes we experience it over our anatomical heart.
Mhm.
But the idea that the mind, the term mind, encompasses so much more than the anatomical structures of the brain,
Absolutely.
and that our experience of mental health, as we call it, is really a whole being experience that
It's not isolated.
is not isolated to the brain. And so that feels important to kind of like name what you and I are describing, experiences we personally had or had with patients, is that we need to feel deeply, um, to be well in life. And if we block that feeling body,
Mhm.
then it really like hinders our ability to, you know, completely have health. And that's, I think, again, why I went down that road on the medication discussion, is
Mhm.
because in a way, the medication is a reinforcing way to kind of, like you said, people close off their heart,
Mhm.
like, and you see this, visually in meetings, but they're closed. Like, it's almost like the drugs can be a way to further reinforce that closeness,
Right, and
because you're
that's when
not connecting to the whole beings.
and that's when
Yeah.
you tend to see the emptiness in somebody's face and their facial features change.
Yeah.
That's what I've noticed. And
Yeah.
then when they start to heal and they do therapy and they're no longer on meds and whatnot, they sometimes look 10 years younger.
Yeah.
What'd you do?
Yeah, totally.
It's like, what have you
Yeah.
been doing? Hot and cold plunges? What's going
Right.
on?
Yeah. And I have to say something, because we're really short on time. Like, I want to be very clear to our community here, and to everyone who's listening to this lecture, that I completely believe in the judicious use of powerful prescription medications that really alter these communication pathways in appropriate spaces. And how I define an appropriate space is when your mental health is so unstable that you cannot function physically in your life. You can't feed yourself. You can't pay your bills. You can't, drive your car. You can't take care of your children.
You have 7 days of dishes in your
Yeah.
kitchen sink and you
Yeah.
haven't changed your clothes for 5
Yeah.
days.
And your mental health is so unstable that you are not functioning. Getting stability is a priority, right? It is
Mhm.
anything that can, as quickly as possible, stabilize you to foundationally take care of yourself is top order and priority. Um, and so I want to be really clear that there are times in my career where I have seen someone in those states, and I have said this tool, a high neuroleptic is the class of meds we call it, but like we've named a few of them today. This is going to be something pretty necessary right in this moment to get you stable
Mhm.
so that you can function, so that then once you're stable and you're functioning, we can ask the questions: how did you get here?
Mhm.
What is the deeper story, the physical body, the ancestral historical pieces to how you came to be in this super destabilized mental state? And, unfortunately, our medical community essentially, a lot of times they'll say, oh, it's just genetic, which is like just
Mhm.
so far from the truth in my experience, that,
I don't
and I
agree
think
with
that's
that.
what you're alluding to,
Yes,
is
it is.
you talked about PTSD and, a lot of other forces about our community, our environment, our physical health, environment, our practices of processing and feeling our emotions, and how we've been learned that in life or not. And I feel like that's really the conversation I hope to kind of communicate here. Is I would hate people to leave this meeting saying, basically, Dr. Hunter says that, neuroleptic or psychiatric medication is evil,
Psychotropic, yeah.
psychotropic medication is evil, and that it's ruining, that we're on a severely wrong path having it available to us.
There
I
are
feel,
times and places that
yeah,
I've
yeah,
had to.
yeah,
I mean, if you have somebody that their mood fluctuates from one extreme to another and I don't know, they're jumping out of airplanes without parachutes, there's a problem,
yeah,
you know?
yeah, yeah,
You need something on board to keep them safe. And my way of saying it is, if that has to happen, let's try this. It doesn't mean that you have to be on it forever.
yeah,
And it's like you said, you have a little bit of an opportunity that way, or a lot, to meet with them the next time and dig deeper
yeah,
and figure out what's really going on.
yeah. Yeah, and again, I want to also take it a further step and say, to be clear, I would never judge a patient who came to work with me that says this medication really helps me. It's really important to my well-being, and I feel happier and healthier on it. And if, I will take their word for it, but I'll also ask about what else is going on with them. And if, I sincerely believe that some of the things they're really not happy about in their life are connected to the medication, I will also acknowledge that. But generally, I also want to be very clear that for many people, these these medications are lifesavers. They are game changers, and they create function and stability profoundly for people. And people are, you know, deeply grateful for their existence and ability to access them, to have their health mentally and
Maximized.
and physically. So it's not a, this isn't a universality of what I'm sharing, but I will also turn the coin over and say that many people who come to see me were not put on these medications, that are on these medications, were not put on them in a massive mental health crisis, unstabilized,
Right.
dysfunctional, not able to, like, and they were told that they're going to take it for the rest of their life when they were put on it. It wasn't like, hey, we're going to get you stable and this will help. And then we're going to work on the underlying forces that brought you into this unstable
There's not enough
place.
money in that. We don't want to get into that topic today.
Well, let's keep the high road here. But the point of, I hope in like kind of bringing us toward a wrap out is that, both in the mental health world, and there are practitioners in the mental health world that believe in the whole person exploration and understanding of the mind and body as a way to get to the roots of where mental health pain has arisen from. And on my side, in the physical medicine doctoring side, there is this powerful ability to appreciate the complexity of everything that influences someone's mind, and also how that affects their health as a whole, and how that affects their physical health, that deserve deep exploring and help. And then the mind's quality and function and freedom and well-being, how all of these physical inputs end up contributing to it. And that this, we all deserve to, if we're really struggling in a physical way or in a mind way, and we need help with it, access to people who will really look at all of that with us, who have the skill set, knowledge, and foundation to either say, let's explore all these things, and I have all these tools and in ways to relate once we illuminate what's really not working there, or I know this and this people who can really help you now that we've illuminated that these aren't working. And I think that's the spirit of, collaboration, as you've mentioned numerous times, is that, these all these aspects of our health are connected. And so hopefully, even though our lecture people tuning in probably didn't get like a bunch of like nuggets of take these supplements for anxiety, or these, fundamentally that's not kind of the goal of this meeting, because in that case what we're essentially doing is we're transposing this thought process of, oh, you can take a pill to change that. And I really actually don't look at my natural medicines as like really dramatically shifting the state of really physical health or mental health. They play a role alongside many other investigations and engagements. When we comprehensively engage that, lead to more robust vitality, mental, physical health, well-being.
Right.
And so that kind of, I wanted to make that little statement before we wrap out. Like, yeah, I mean, I didn't leave much space for talking about, this herb or that nutrient or that vitamin. We use them all the time. I think even you suggest them quite frequently as supportive.
Well, you did mention vitamin D, getting out in the sun, walking.
Yeah. Vitamin D is, we have all sorts of research about mood and mental health with vitamin D. We have all sorts of research with magnesium and anxiety and tension. And, and I mean, we could make a list here and go on and talk about each nutrient individually and how they interact in each herb.
Right.
But I think that the concept and point of this meeting is, we want to emphasize the breadth and depth of exploration of how complex our health is.
Very complex.
As really the work we were equipped and desiring to do with our community to help them lead a better life and care and ultimately, have a higher level of health.
Right.
Yeah. So any closing thoughts, or does that feel like a nice sweet spot to end on?
That feels great.
Cool. All right. Well, thanks everyone for being in on the call. And thank you, Carrie, for being here today
Thank you for
with
having
me.
me. Everybody
Okay.
have a good day.
Bye-bye, everyone.